Thank you for joining us today for our Safer at Home during the COVID-19 pandemic. This program is a partnership between Hispanic UMADAP and the Cleveland Clinic. It will present a guide developed by the Cleveland Clinic and the Clorox Foundation Corporation entitled Safer at Home, Your Guide to the Coronavirus Pandemic. I am Nelson Ramirez, Executive Director at Hispanic UMADAP. Today, you will have the opportunity to hear from two dynamic presenters. Our first presenter, Dr. Blanca Gonzalez, MD, Associate Professor of Pediatrics at Cleveland Clinic Lerner College of Medicine. Our co-presenter is Dr. Hernando Sayas Santiago, Clinical Assistant Professor of Pediatrics at Cleveland Clinic Lerner College of Medicine. Please note that all lines will be muted during the webinar. We kindly ask that you use the chat feature within the webinar to submit any questions to our presenters. We will do our best to answer all the questions during the presentation, in a future forum, or through a direct response. Thank you again for your participation and your continued support. Enjoy the session. At this time, I would like to welcome our first presenter, Dr. Blanca Gonzalez.
Hi, thank you very much for the invitation and the opportunity to be able to share this information with our Hispanic community. So the objectives of this presentation is that we want to describe the current COVID-19 situation in the United States and in Northeast Ohio. We want to summarize the measures that you can take at home to create a safer home environment during this COVID-19 pandemic. Just talk a little bit about stressors that this pandemic has brought us and some basic steps to cope. And then we're going to discuss a little bit about the COVID vaccine, which is currently, I think, a topic of great importance. So, as I don't have to tell you too much about this virus anymore, but we know that this was a virus that emerged from the province of Wuhan in China in the late 2019, with the first cases described in the United States as early as January of 2020. First case in Ohio was in January of 2020 as well, and it was not until March of 2020 that it was declared a pandemic, meaning that there was widespread activity in the world. So as you can see, we are currently in the situation in which we've had the most cases since the pandemic started. And up to date, the Americas has seen 41 million cases of COVID. Europe has seen more than 30 million cases, and Southeast Asia more than 12 million cases. Where are we? So in the United States, as we can see us here on the map, we have had more than 23 million confirmed cases, and unfortunately more than 400,000 deaths at the time. So this is lagging a little bit behind. And the world has seen a total of 93 million cases with more than 2 million deaths. So you can see that the deaths in the United States are a little bit under a quarter of the world mortality. So where are we in our state of Ohio? So as of Monday, we had over 800,000 cases in the state, with over 40,000 hospitalizations, over 6,000 admissions to intensive care unit, and unfortunately with over 10,000 deaths. the range of the infections have been in even babies as you know, as less than 1 year of age to 111 years of age, with 46% occurring in males and 50% in females. We can see that when we look at our Hispanic population, we are 4% of the Ohio population. We have seen the cases in the Hispanic population have been up to 3.1%. We are 3.5% of hospitalized patients have been Hispanic, and 1.8% of the deaths have also been in the Hispanic community. So talking a little bit about transmission. So how do we transmit the virus? So the main way of transmission is really through small particles called droplets, which are produced whenever we cough, we sing, we laugh, or even breathing. And then the person who's next to us or close to us will breathe these through their nose, mouth, airways, lungs, and then the infection happens. And this is thought to be the main way that the virus spreads from one person to the other. So droplets can also land on objects and transferred by touch. So if you touch somebody coughs on a surface and you touch it right afterwards, and then you touch your nose and your mouth or your eyes, then you can also get the infection. This is not thought to be the main way that you get the infection. The main way one gets the infection is through those droplets. And sometimes, when you talk, when you speak, same activities, some of these smaller respiratory droplets can stay suspended in the air for some minutes and sometimes hours, and can go further than those 6 feet away, and that's what's called airborne. And this method of transmission has been shown to happen with coronavirus, but not as often as droplets. And where would it happen more? Well, in places where that have poor ventilation, like restaurants, fitness classes, choir practices, etc. So again, the difference between droplet and airborne droplet, you cough, are much larger drops, and they last in the air for seconds to minutes, whereas the airborne transmission takes, these can stay up and particles can stay in the air, travel a little bit further than 6 feet, and can stay for many minutes and hours. But again, to emphasize that droplet transmission is the main way we think that this virus is transmitted. And again, this is a summary. So an infected individual coughs, breathes, talks, and then a susceptible individual will breathe it, and this is through droplets. But on some occasions, some of these smaller particles will stay suspended in the air, travel a little bit further, and still be able to be breathed in by some other individual. And sometimes we can, contaminated secretions can contaminate surfaces that if somebody touches them and touches their eyes, their mouths, or nose, can also become infected. So I'm going to go over a little bit about the virus, and just so that when we talk about vaccines, we understand where we are, what I'm talking about. So the coronavirus, which is an RNA virus, has these proteins outside called the spike proteins. These spike proteins, when you breathe the coronavirus, these spike proteins will attach to a receptor that is in some of some of our cells, in our respiratory tract, etc. And then that interaction between the receptor and the spike protein is what allows the virus to get access into your cell and cause the infection. Eventually, your body, will produce antibodies against these the coronavirus and these spike proteins and protect you down the road. So this is what happens if you have a natural infection with coronavirus. Just to talk about, a few cases in the United States have been reported in pets as well. These are, in this graph, you can see some of the states where some animals have been infected. Cats have been the majority of animals that have been infected. But the important thing is to know that the transmission has been from human to animal and not the other way around, and that the risk of the animal spreading COVID to people is considered low. But this just emphasizes that we should treat our pets as part of our household. So it's not the time to be sharing your dog with somebody you haven't seen for a long time, or your cat or something like that. So when we talk about COVID and the clinical presentations, the most common infections that we see, the symptoms will occur anywhere between 2 to 14 days after exposure, and they will present with cough, difficulty breathing, fever, chills, muscle pain, sore throat. A large majority of patients will have loss of taste and smell. And some may present with gastrointestinal symptoms only, like nausea, vomiting, diarrhea. Some will even present with skin rashes. But some patients will have very mild symptoms or no symptoms at all and be what we call asymptomatic. But it is important to stress that transmission may still occur from patients that have no symptoms to the rest of the population. One thing that we wanted to comment on is a syndrome that we have been seeing, us pediatricians in the hospital, which is called the multisystem inflammatory syndrome that you may have heard in the news. And it usually presents in children. There are some adults that can also have the syndrome, but the majority are children less than 21 years of age, and usually 4 weeks after a COVID-19 infection. Some of the children don't even know that they have the infection. They may have been asymptomatic. And children will present with fever, abdominal pain, diarrhea, difficulty breathing, red eyes, rashes. And these patients need specific treatment for this syndrome. And so it's important, also to recognize that children may not develop as severe disease from the respiratory standpoint, but these syndromes are happening in children. So, so it's important to protect our children as well. So we're going to talk a little bit about, start talking about how to protect ourselves. And so this is what we call the Swiss cheese model. And what this wants to tell you that if I only used one measure in itself, there will always be holes in which the virus could, break through. For example, you're using a cloth mask and it turns out that maybe you weren't wearing it correctly, or somebody was, or there was too much, somebody was too close to you, then the cloth mask is not going to protect you completely. But if you add to the cloth mask social distancing, then you have an additional layer of protection. But still, it might not be sufficient because maybe you got home and you're not wearing your mask, and but you were bringing the virus home, and you still didn't clean or disinfect your surfaces. So that's another hole. And then hand washing. So all these measures together will actually every time decrease the transmission of that virus. And of course, we're going to add one additional protection layer for us, which is the development of, the vaccination of our population. So when we talk about layer one is our face mask. So again, remember, just to remind ourselves that the main transmission is through these droplets. And what happens if a person who is infected and is asymptomatic is talking to healthy people? If she is not wearing a mask and one person is wearing a mask and another is not wearing a mask, we are all still, that possibility of infection, can be there, especially for this person who is not wearing a mask. But if the person who is asymptomatic is wearing a mask and the healthy, people are wearing a mask, then there's a substantial reduction in the transmission. So that's why it's very important to wear the mask in addition to all the other layers that we're talking about. And so how do we wear the mask? So I think that the most important thing is that it needs to cover your mouth and your nose. If it's not covering your mouth and your nose, it's not doing its job. And you want to make sure that it should fit snugly to the sides of your face, and you have to secure it with ties or ear loops. Ideally, if you are using, the mask should be made by multiple layers of material, but you have to be able to breathe without restriction. And if you have cloth masks, you need to make sure that they are made of material that is not going to change shapes after washes, because if it changes shapes and it does not fit snugly around your nose and your mouth, it will not be doing its purpose. And disposable masks should be thrown away after each use, and regular use of cloth mask is encouraged. I only use cloth masks once a day, and then I wash that mask. So how do you wear a mask? It's not a necklace, so it should never be on your neck. It's not a goatee, so your beard does not need to be protected. And it's not a mask visor. It needs to cover your nose and it needs to cover your mouth. It does not belong in, it's not a purse either. If you have it, you use it. And for us physicians who have, deal a lot with patients, and for other people, communication is very important. And yes, we have found that sometimes it's hard for people to listen to us. So for example, I speak very softly and I have had to increase the volume that I usually speak as, and now I have to speak louder because I know that with the mask, people may not hear me. So I speak slowly, I speak loud, I try, within my 6 feet of distance, I do face my patients and make sure that we keep eye contact so that we Latinos especially, we talk with our hands and our eyes and everything else. So that, that also helps us communicate. But sometimes if you're not sure that somebody heard or understood you, it's good to go back and ask them, was I clear? Did you hear me? Should I repeat it, etc.? You can use, there's all kinds of apps, especially for the younger population, that they can try speech to text app. You can use, if you host a virtual meeting, that's easy because you can adjust your settings. And maybe this is an opportunity to ask yourself, if I'm not hearing well, do I have a problem? Do I have to go and visit an audiologist and make sure that that's okay? Or if you already use a hearing device, maybe it's, you can talk to your audiologist and say, can I have, make some settings that will allow you to listen to people who are wearing masks. So those are all the things that you can do to improve communication while we're doing masks and shields and all that. So layer 2 is really hand washing. I think hand washing is one of the other most important aspects of this Swiss cheese model. And these things we actually, with or without a pandemic, we should already be doing this. This is not a pandemic exclusive. This should be part of what you do on a daily basis. And so, this is what I tell my 14-year-old child. You have to wash your hands whenever they look dirty. If you're going to prepare food, and before you eat and before you prepare food, you're gonna, if you're gonna visit somebody who's ill, or you're caring for somebody at home who's ill, before and after. If you are treating a wound, before and after you treat the wound. If you're going to the toilet, if you're changing diapers. Whenever I leave my house, I wash my hands before I leave my house, and the first thing I do when I come back home is wash my hands. Of course, after you blow your nose, coughing and sneezing, you want to do that. After you touch animals, after you change your cat litter, after you do all these things, or when you take out the trash or any of that, you should be washing your hands. So, the best method is to use soap and water. And if you ever wondered how soap works, what you do when you wash your hands with soap, what happens is that grease, the oil, the dirt, the viruses, the bacteria, all really become dislodged from your hands, and you create like a little bubble. And then that bubble, the water can actually wash away, literally, and as opposed to it staying in your hands. So that's how soap works. And why do we want to do these 20 seconds, Why do you want to wash your hands for 20 seconds? You want to make sure that you reach all the aspects of your hands. It's not just your palms that you want to get the back of your hands, between your fingers, under your nails, your wrists, so you want to do. So you can sing Cumpleaños Feliz twice. If you sing Cumpleaños Feliz twice at a decent speed, it'll be 20 seconds. You can try it on a timer, and then you will get the 20 seconds with Cumpleaños Feliz and you're done. And I usually turn off the tap when I'm lathering my hands so that I don't feel pressured that the water is running and that I'm, this is not good for the environment. So I wet my hands, close the water, lather my hands for the 20 seconds, then open my, with my elbow, I open again the faucet, rinse my hands, and then close it. And you want to try not to touch that faucet, with the handle with your hands that you just washed. So usually you grab, you close it with your elbow and then grab a towel, you clean, you dry them, dry them, and then with that same towel that I used, I open the door to leave the bathroom. So that as not to, just wash my hands as not to get contaminated again. However, sometimes we don't have soap and water readily available. So what you can do is use hand sanitizers, but hand sanitizers can only be used when you don't have visible soiled hands. If your hands are visibly soiled, you have to use soap and water. But hand sanitizers, are an alternative when your hands are not visibly, so you don't have dirt that you can see in your hands. So you go ahead and you wash them, and the same way that you would with soap and water. And you have, make sure that it gets between your fingers, not just your palms and the back of your hands. And you have to allow it to dry. If you don't allow it to dry and it's still wet and you touch a surface, you're not protected. It has to dry. And so then we talk a little bit about layer 3, which is I think for us Latinos, the more terrible one, which is the social distancing and the physical distancing. So remember again, all going back to that same concept, your droplets are going to fall within 6 feet mostly. And that's why if we can stay away from 6 feet from other people, those droplets are really going to not reach us, or we don't want them to reach us. And so that's why social distancing and physical distancing becomes important. So whenever you go to to do some of your basic needs that we need to do in the community, like going to the supermarket or going to the pharmacy or going to the doctor, you can see, you always have to pay attention, because people have, all these places have done their research, and they're CDC compliant, and they want you to be safe at the store or at the hospital or wherever. And so you look at they spaced out markings, and you just have to pay attention and find them. If you are going to eat outside, and which is the safer of the options of outdoor eating, of eating in a restaurant, you have to make sure that that the site, the locality is being compliant with this 6 feet. So if people are sitting next to each other, then that's not a place where you have to eat. Sometimes, like if you have a dear one in the hospital and you have to use the cafeteria, then you may have to do some inside dining, but pay attention to how the tables are distributed and so forth. When you go hiking and you go on a ride, or there's nobody, of course, you don't have to use the mask and you don't have to do social distancing. But sometimes you go hiking and there's a lot of people hiking and a lot of people walking. So that's when you want to keep your mask handy. And, and when you see somebody, then, try to go the other way. I always tell my son, it's like playing a zombie game. Here comes the zombies. We're going to the other side. So, just to make sure that you maintain that distancing, even if you're outdoors. Again, outside is always better than inside. When in an elevator, you have to try to maintain your social distance. So stop and see how many people are on the elevator, how many corners are marked as safe, and then you can decide if you get on or not. And if you are able to, because you are in good physical conditions, whenever you can use the steps, then use them. That's a free exercise as well, especially if you're going up. And look for distance marks wherever you go. And of course, the social distancing part, I think that's the one that has been the most detrimental for all of us and our mental health, is because we can't see our loved ones. We can't gather for Christmas. We couldn't gather for Thanksgiving. We couldn't gather for New Year's and all the other celebrations that we, as a Latin community, really, family and, friends are very important to us. However, this is when you have to make a choice as an individual and decide, it is my personally, not because anybody is telling me to do so, it's because I know so, that I have to protect my mother, my son, my wife. So in my house, for instance, my mom, who's 77 years old, she came to visit from Venezuela, and she is, I have to protect her. I have to make sure that she does not get infected. And then I have a 14-year-old child that I want him to be protected as well. So that's why I stick to all these recommendations. So what ways can we stay in touch with our loved ones? Thank goodness that we have social media platforms. There's all kinds of social media that we can get. We can FaceTime, we can do all kinds of activities and platforms that are available now. And the other thing is that, sometimes I love receiving letters, handwritten letters. Still go back to your basics, and that still is a way to communicate without having, if you don't have a tablet or something like that, you can still write letters, send postcards, and that's a good way of keeping in touch with loved ones. So our layer 4 of this, is cleaning and disinfecting the house. So this is a very important part because this is what's going to keep us safe at home. And so, we're used to always cleaning the room, the bathrooms and the kitchen. That is something that we do on a routine basis. But one of the things that we have to make sure that we do is try to disinfect the smaller objects that people touch frequently, and that maybe before the pandemic, we weren't so keen or paid attention to much, like the light switches, like the doorknobs, like the remote control. Like if it's, kids are always fighting for the remote control and they're eating and doing all kinds of activities while changing the TV. So that is probably full of germs. Your house keys, your electronic devices. So it is very important that you also get into the routine of cleaning these as well. So remember that anytime you use a product, you have to read and follow the instructions on the label because they're all different. Some are cleaners and disinfectants, some are just cleaners, some are just disinfectants. So you have to make sure that you understand, what they are. So anytime we start out, you have to clean a surface, which is mainly removing soil. So, if you have dust, you're not going to put some chlorine inside, on top of dust if you haven't removed it first. So you want to first remove the soil, and then when you're going to apply the disinfectant. And you're going to wait a period of time for this disinfectant to act. And then once it's ready, then you can consider that surface clean. The CDC always recommends that you do cleaning with gloves, which would be discarded after that, and wash hands. Some people will use rubber gloves if they don't have these gloves, but make sure that if you're going to reuse those rubber gloves, that you will wash them, with soap and water, just like you did for the 20 seconds with hot water, and then you remove them and then soak them again inside out for at least another, several minutes with soap and water solution, and then let them dry for safe reuse. So again, read product labels with for instructions, be organized and methodical. So if you're going to clean the bathroom, you might start with easy areas to clean, and then, tackle the areas that are more difficult to clean, like the bathroom. Clean from high areas to low areas. So if you're dusting your bookcase, don't start from the bottom, because once you reach the top, you're gonna, it's all gonna land on the floor again. So make sure you clean from high to low areas, and you want to minimize cross-contamination by not using the same wipe. So I'm cleaning the toilet is not the same wipe that I'm going to use to clean the sink. So make sure that you don't cross-contaminate, and then you use products that is cleaner and disinfectant at the same time is usually easier. So moving to the next topic is what to do if somebody in your household gets infected with COVID-19. And so, one of the things that I always tell my patients and, people who ask me, planning ahead goes a long way. So having a plan is always take some stress out of you, because you can then if this happens, then you're already prepared. So, have a plan, this is the room I'm going to use if somebody gets sick. These are the linens that I'm going to use if somebody gets sick. Make yourself a little kit just in case somebody gets sick. But the first thing you need to do is notify that person's primary care physician. And if they don't have a primary care physician, there are lots of online platforms that you can utilize now from many healthcare systems. We at the Cleveland Clinic have Express Care Online, and that you can reach and make appointments and talk to somebody who can guide you through the process of whether you need to be tested, whether and all the other situations. So you isolate that person who is sick until 10 days have elapsed since the first symptom appeared, and the person must have no fevers for the last 24 hours without giving them any fever reducing medication, and their symptoms have to be better. So If 10 days have passed and you're still having fevers and you're still coughing, you cannot come out of isolation. Okay, and then it's your responsibility, and it, is to inform your recent contacts. You have to be responsible and respectful of all the other people who you consider your friends or people who you came in contact with, and tell them, we have a situation, we have a case, and don't feel, nobody is this. We're in a situation of a pandemic. This can happen to anybody, and I think it's very important to be be upfront and honest with the people that you talk to. So, if somebody's sick at home with COVID, you should not have anybody visiting the house. And all the household members have to stay home for 14 days. And why is that? Because the incubation period for the virus is 14 days. So after you have reached those 14 days, that's when, if you did not get sick, you probably, you're not going to get sick. And so you have to monitor everybody who lives in the house for symptoms. Wear a face mask while you're caring for your sick individual, because if you're not sick, you don't want to get the disease. Wash your hands very often. You should eat, in my plan, the person who is sick, we are going to take the food to his room. And that's my plan, because we want to eat in separate rooms. And I have a glass, I have some utensils and a plate that this is going to be just for that person. And when I bring, when my plan is that if somebody gets sick in my house and I am going to wash that, I have to make sure that I'm washing those utensils and plates with gloves. And that's a good use of gloves in that sense, because you don't want to be touching secretions, the saliva that could have come in the hand, in contact with you. And then I also will have a dedicated lined trash for the sick individual, and maybe also a hamper so that I can put all the things that are in that room and then take them safely either outside, to the trash, and one for the and one to wash items. And you have to make sure that individual stays hydrated, and you have to very much monitor for warning signs, which is, do they have trouble breathing? Do they have pain, chest pain, confusion? Do they look blue? Can they not walk? Can they not stay awake? These are warning signs for you that tell you, the situation is worsening. We have to call 911 and and very importantly, just because we also want to keep our primary response, responders safe, is also let them know that they have the individual has COVID. And not only for that, but so that they can also anticipate, what the situation is. So I think you have to be very, don't be afraid. The hospitals are there to help you. And, and if you don't feel well, that's when you have to go and find help. So all this that we just talked about is really making us all stressed and worried, and, the pandemic in itself. And that has, we have changed our sleeping habits and our eating habits. For me, I started eating chocolates that I never ate chocolates, and I ate too many chocolates, and I gained a lot of weight. And then I had to come and stop and say, okay, there's something wrong. I cannot continue eating this way. And so this has happened to many people. Some people have been afraid to go to the hospitals, and take care of their own medical conditions. And that has led to some people getting into trouble with that. And the same thing, there's been increase in use of alcohol, tobacco, all these things, because we understand that this is a very stressful situation for all of us. And so managing stress is something that everybody has to try to do. And so by even exercising regularly, you go out for a walk, I pick times of the day, which I know that people are not there. So I walk at 6 o'clock in the morning, and that's, at 5:30, or sometimes I walk at, later at night with a flashlight or whatever, but try to get some exercise, or, exercise in your basement or doing something like that. Try to maintain a healthy diet as much as you can, or, try not to eat all these sweets and candies and things that, are not good for you. Try to connect with other people. Like we said, I think even though we are physically isolated, we can still call people on the phone. We can use our, our phones, and find other people for support. Take breaks when you need. So sitting in a chair and just taking deep breaths for, take a nice, slow, deep breath for a few minutes. I think that can, take some stress away from you, and try to sleep as much as, get a good night's sleep. Don't, people are staying up till 2 o'clock in the morning with their tablets, and, especially when we've been confined inside, so trying to maintain your sleep routines is very important. So I want to spend the last 15 minutes when we talk a little bit about the vaccine. And so we're going to just start explaining to you, how do we develop immunity after we've had an infection, after or immunity for infection. So you can either get sick, and then your body will produce antibodies against the infection. That's the hard way of doing this, because you have to get sick, you have to get well and get over the infection. And not everybody is the same. So if you're an immunocompromised patient, you're patients who are receiving cancer treatment or had a transplant, or, you may not respond, you may not make the same antibodies either, and you may get sicker with the infection. So that's why it's, so and not everybody is the same. And then we have the easier way, which is through vaccinations. And so that's what we're going to talk a little bit about. And I have to say that vaccines have been one of the greatest success stories in the history of mankind. And I can give you, in the last 50 years, we have had some fantastic progress in vaccines. And I'll give you some examples. For example, the polio vaccine was introduced in 1955. And after the polio vaccine, we are currently in the verge of eradicating polio from the world. So we have very few countries that have had one case or two cases, and we are going up ahead of plans of getting rid of polio for good. In 1977, in the 60s, 66 and 67, the smallpox campaigns really took off. And by the 70s, we had no more smallpox in the world. So that's not a miracle in itself, And then other things, we have vaccines for hepatitis B. The measles cases, they have gone down substantially after we started measles vaccinations. Here's an example. We used to have 700,000, 800,000 cases in the UK of measles. And once the vaccine was introduced, they all went away. And then same thing with the polio vaccine. So, vaccines are really one of the biggest and success stories of medicine. And when we think about vaccines, vaccines, how do we develop vaccines? This is the usual way vaccines are developed. So this is, before the vaccine, before you see a drug reach the population, even before trials, scientists have been working on these vaccines for decades. And then for the actual coronavirus vaccines, there's been decades of research of these mRNA vaccines. So then once the manufacturers say, the scientists say, yes, we think we have a vaccine that is effective, then we start with the phase 1, 2, and 3 trials, in which we start trying it on volunteers. We start small with 20 to 100 volunteers first, and we're only looking here to see, is it safe? Does it seem to work? Do we have side effects? And then, is this related to the dose of the vaccine? And then after that, then we try, if this was successful, then we go to phase 2, and then we say, well, let's see more people, and what are the side effects, and how are they responding to the vaccine? And then if this goes well, then it goes to phase 3 trials. It has to pass this one, and then to this one, and then now it's hundreds of volunteers. And I can give you examples that for the Pfizer vaccine trial for the coronavirus, there were more than 44,000 people in the trial. And for the Moderna vaccine, 30,000 people in the trial. And then after you do that, then the FDA has to sit down and has to look at the data. And then after you start the production, they will go to the factories and make sure that the batches are safe. And there's a lot of work that goes into the development of vaccine. But sometimes, like in this coronavirus pandemic, we didn't have medications, we didn't have tests, and we didn't have vaccines to combat this virus. And so the FDA sometimes can issue something called that is the emergency use authorization, in which what they're trying to do is that they follow a very strict process, but they evaluate all the what do we have available, and then we carefully balance the risk of these products, with the benefits to the public that would be made available. And what does this process do? Well, it's kind of the same process that I showed you before, but it's a little, maybe in time, it may be, and one of the things that when you think about the vaccine trials during this pandemic, usually when vaccines are trialed, sometimes there is not a whole lot of people sick at that time. But when you're in the middle of a pandemic, you have the largest exposure to the offending agent, and vaccine efficacy can be seen, much, in a clearer way. So again, still, it has to go by many rigorous hurdles before the FDA decides that the data is solid, that there has been enough time from the vaccine application to the time they review the data, and before they say, okay, let's go ahead and do this because this is effective and this is safe. And so, there we come to the COVID vaccine. So it's what it's called an RNA vaccine. And what it does is it's going to give instructions to our cells on how to make that, remember that spike protein that we talked about? So it's going to tell your body, listen, here are the instructions of how to make that spike protein so that the immune system, instead of having to get the virus by an infection, it gets it through the vaccine, so that you give instructions of how to replicate that so the immune system can develop antibodies. So what you do is that so the RNA gives instructions to our cells on how to make a harmless part of the coronavirus, which is this spike protein, which is on the surface of the virus. And then when it gets into your upper arm, the instructions are delivered by this messenger mRNA, and your cells decode the mRNA. They now know how to make the spike protein, and they get rid of the mRNA. And then what happens? The body system starts making antibodies against that spike protein, and voila, you are now, develop immunity to the vaccine. It's very important to tell you because you hear people say, no, it's going to change my DNA. It does not change your DNA because the vaccine will never enter the nucleus of your cells where your DNA is safely kept. And so the vaccine, it's important to remember, the vaccine does not contain a virus. This is not a viral vaccine. And that is why we are going to be able to vaccinate our immune compromised patients, because this vaccine does not contain a virus. It contains information to replicate a part of the virus to which you make antibodies. And then the cell is going to get, once it reads the message, it says, okay, thank you very much, you're done, and it's destroyed. And that's it. And it's very short-lived. So we have two vaccines out there. One is the Pfizer vaccine, the other is the Moderna vaccine, and they act the same way. And I think that the only real difference is that the Pfizer vaccine was studied in 16 years of age and older. Some of your teenagers who are 16 and older can be vaccinated, whereas the Moderna vaccine is only approved for 18 and older. The interval in between the dose 1 and 2 is 21 days, and the one in between the Moderna is 28 days. And why do we need 2 doses of these vaccines? Well, these vaccines were developed as the first dose is like a meet and greet for your immune system. It'll tell you, hi, so you produce the antibodies, the first batch of antibodies, and the second one is when you boost it so that it produces more antibodies. And after the second dose, 10 to 14 days after that second dose, then you can consider that you have the benefits of the immunity that for these vaccines are between 90 and 95% when you've received 2 doses. What are the contraindications? Well, allergic reactions to the COVID vaccine, like if you've had a severe allergic reaction to the first dose or to any of the ingredients of the vaccine. So that's why you should touch base with your doctor and say, are my allergies, are going to be a problem with the vaccine. Side effects are very similar to both, and much is, some people can get injection site redness or pain, a little pain or swelling, just like we do with other vaccines. You can get tired, you can get headaches, you can get muscle pains, chills, fevers, nausea, and some people get nothing at all. I had we received us 3 have received the vaccines, and I did not get any side effects. So I just had a little bit of soreness maybe. And so these are, and I think the way I always frame this too, because people like to instill fear. And I always say it the same way, I have only one child. He's the love of my life. I would never do anything that, would make me or him sick, and I take my vaccines because I want to be protected. And so I just wanted to give you that, that I wouldn't do anything that would harm anybody. And that's why it's important that when these vaccines, when your turn comes around and you're offered the vaccine, know that these vaccines are safe. They're very, the production is controlled, and that they're very safe. Where are we in the vaccination process? Remember that the CDC has issued guidelines of how to roll out the vaccine. And this is because at the beginning, the supply is limited, and as well, we produce more, there will be more. But we want to start with people who are really, the first people who are protected. So healthcare workers that are exposed routinely to COVID patients who, residents of and staff in nursing homes, residents and staff in assisted living facilities. So those were the first groups that were vaccinated. And then we're currently in 1B, in which we're starting to vaccinate 65s and older. This week was 80 and older. Last week was 80 and older. This week was 75 and older, and so goes. And if you are not sure, because this is changing all the time, if you go to coronavirus.ohio.gov, you will have the most up-to-date situation. And I can tell you, I downloaded this morning from the Ohio, just to know how many people in Ohio have received at least one dose of the vaccine. And these are the numbers. So, we have, up-to-date, greater 36.65% of our residents of Ohio greater than 80 have received at least one vaccine, and so on and so forth. So further plans are still in development, so that's why you have to check for updates. And then again, one of the things is that unfortunately, even if you receive 2 doses of the vaccine, we will still need to continue the basic precautions. And why is that? Because until we reach a critical number of the population that is either vaccinated, that has antibodies to the coronavirus, there will still be transmission of the virus in the community. And one thing that the scientists still don't know is that, can you get infected but not get sick and still transmit it to others? And that is still not very clear. And because that's not clear, we want to improve our chances of beating this. So even if you have your vaccines, you still have to take all the precautions that we talked about. And so in conclusions, remember, we're in the midst of a COVID-19 pandemic. This is not the time to relax yourself and, and not pay attention. We need to keep ourselves safe. We must continue to wear a mask, stay at least 6 feet, avoid crowds, avoid poorly ventilated spaces, wash your hands often, clean your house. Cleaning and disinfecting the home adds an additional layer. And there's a light at the end of the tunnels with these vaccines. And remember that vaccines are safe, they save lives, and they undergo a rigorous monitoring process before they reach you. And again, and this is a direct quote from the CDC, while experts learn more about the protection that COVID-19 vaccines provide under real-life conditions, it will be important for everyone to continue using all the tools to stop this pandemic. And again, reminder that it's not me, it's not just you, it's that we are all in this together, and it's the efforts of all of us Latin community that will help us, stop the spread of this virus. You can reach some more of this information at clevelandclinic.org/coronavirus. And other important resources for you are from the cdc.gov/coronavirus or coronavirus.ohio.gov and and this is from the World Health Organization. So if you have questions, these are the sites that I think that, these are some of the sites that you can reach that have good and reliable information. And that brings us to the end of our presentation. Thank you very much.
Thank you, Dr. Gonzalez. Great job. Strong work. And thank you, Dr. Zaya Santiago, as well. As you've noticed, he provided some answers to the questions. So I'm Janice Gonzalez, and I'm just going to read some of the questions and the answers. And then we have some open questions as well. The first question that was put out there was, how long does the virus droplets remain contagious on the surfaces? And Dr. Zaya Santiago said, per the CDC, mostly minutes to hours. There is some research that states some surfaces, such as hard metal It could live longer. So think about your mail that's coming in. Whenever you open your mail, you want to make sure you wash your hands. The key is frequent cleaning and disinfecting of high frequent use surfaces and objects, which we will discuss further. Doctors, did you want to say anything more to that question?
No, I think that accurately answers that. I think, again, it's because it's not the main way that this virus is transmitted. I think, at the beginning we were wiping down all our boxes and everything from the supermarket, but the CDC, has really said, well, that is not, as long as you wash your hands after going to the supermarket, then that's what I do after I don't put my bags on the table that I eat, and I put them in a place that I've designated them, and then I wash my hands, after I've unpacked everything. And I think that would, if you try to do that way, if you put your bags on the table, make sure that you disinfect your table after you've disposed everything that you were not going to keep.
Thank you, Doctor. The other question is, do we stay in isolation 14 days from the onset of symptoms or 14 days from a positive test? Dr. Zaya Santiago said, isolation if infected with COVID for at least 10 days from the initiation or the start of your symptoms, if no fever for 1 day and symptoms improving. If exposed to someone with COVID, make sure to quarantine per the recommendations of the CDC, which are 14 days once exposed, and monitor for symptoms daily. And to add to that, if you continue to have diarrhea, we want to make sure that you are diarrhea free for at least 3 days before you come out of quarantine. Anything more you'd like to add, doctors?
The only other thing I would add is to keep to maintain communication with their, once they are either infected or exposed, maintain communication with their primary care provider or physician, and also keep communication with the occupational health personnel from their workplace, because they're going to be able to provide also more resources in terms of contact tracing, length of quarantine, any testing, when to come back to the workplace. So per the CDC, there are ways that the quarantine period might be shortened, but there have to be very specific guidelines about that the occupational health and the local Department of Health will provide guidance to every individual.
Another question was, can someone clarify for me if a person is only contagious when symptomatic? You can be contagious whether you're symptomatic or you're not symptomatic. And that's how the virus is getting spread, is because people are going around who don't feel like they're sick and are actually spreading the COVID virus around. So, if you've been exposed to someone and you're not symptomatic, you should still get a test and quarantine for 14 days. Yep. We have a couple of open questions. I wear a mask when I go out. How can I politely let someone I need to interact with know that they're not wearing their mask properly?
Yeah, thank you for this question. Typically, the way I approach it, or I have approached it in the past, is I acknowledge the fact that they're wearing the mask and appreciate their efforts. So I let them know, thank you for wearing the mask and keeping me and those around you safe. But I also tell them, but you want to make sure you are safe as well. And you want to make sure you don't get the virus or you don't breathe in these tiny particles. So I would then recommend to make sure that it's covering both the mouth and the nose. So letting them know, thank you for protecting those around you, but keep in mind, you also want to protect yourself. And then letting them know how to do it properly.
Gracias. Do we know if people who had COVID have tested positive again?
So reinfections can happen. They're not common, but there have been some cases of reinfection. Although they've been uncommon, but they can happen. So that's why, it's important until the pandemic is done to continue protecting yourself.
And then quickly, what is the difference between the two COVID vaccines?
So really the mechanism is the same. And like we said, there is only the big two differences is one is approved, the Pfizer vaccine is approved for 16 and above, whereas the Moderna is only for 18 and above. And then the time frame, one is, one can be given within 3 weeks and the other has to wait 4.
And then last but not least, for those who are asking for the presentation, we have recorded this. So we will be happy to give it to you so that you can share the presentation with others in the community. We also have another presentation in strictly Spanish this evening. So there's still time for people to sign up if they would like to be a part of that one. I'll let Nelson Ramirez take it away for closing remarks.
Thank you,
Thanks,
Janice.
physicians.
Thank you very much. And wonderful, wonderful presentation, very informative. And so always keep at the Cleveland Clinic website so you can download the more information and answer some of your other specific information. So again, I want to thank you all for joining us today. Most certainly, I want to thank our presenters, Dr. Blanca Gonzalez and Hernando Sayas Santiago, the Cleveland Clinic Community Care, Cleveland Clinic West Region Community Health Team, Dr. Monica Yepes Rios, Marilyn Alejandro Rodriguez, Janice Gonzalez, Jenny Evans, and Rosemary Miles. Also want to thank the Alcohol, Drug Addiction, Mental Health Services Board of Cuyahoga County and the Ohio Mental Health Addiction Services for partnering with Hispanic Humadap to bring this program to you. We look forward to connecting with you in the near future. Thank you, stay safe, and enjoy the rest of your day.